Are you an athlete experiencing pain on the top side of the kneecap? In this video, we'll be talking about quadriceps tendinopathy, first starting off with how it develops and then moving into an exercise program that'll progress from building up strength of the tendon all the way back to return to sport. Let's talk about how quadriceps tendinopathy develops and how it's actually different than patellar tendinopathy. Both quadriceps and patellar tendinopathy are overload conditions, simply meaning that the loads placed on the tendon have exceeded what they can tolerate, and that leads to the pain, and this can either be an acute overload or a chronic overload. Patellar tendinopathy is commonly referred to as jumper's knee, and this is obviously because it's more common in athletes who jump, like basketball players and volleyball players, and it presents as pain on the bottom side of the patella. Whereas quadriceps tendinopathy is more common in weightlifters, and this is because the quadriceps tendon, which is above the patella, gets loaded in deeper knee flexion, so when we're doing things like squats and lunges, the quadriceps tendon is loaded more than the patellar tendon. The rehab for quadriceps tendinopathy follows a similar framework as patellar tendinopathy, progressing from isometrics to isotonics to return to sport. But there are some modifications to the rehab program to tailor it more to the quadriceps tendon, which will make the exercises more effective. As stated before, the quadriceps tendon is loaded in deeper knee flexion, so to perform an isometric, we can do this on a slant board, which will allow us to get deeper into that squat, loading that quadriceps tendon. For isometric exercises, these are typically held for 30 to 45 seconds and then repeated for 3 to 5 repetitions. To increase the challenge, weight can be added to this exercise, or these can be performed on a single leg. Obviously, balance can be challenging here, so using a wall can be helpful to focus on holding the position as opposed to having to focus on balance. While isometric exercises are a useful starting place, especially for an irritated tendon, it's important that we load the tendon with movement because that's what the demand of sports require. In fact, if tolerated, most cases of quadriceps tendinopathy should actually start with isotonic loading and just skip the isometric phase. And there's a couple of different isotonic exercises that we can start to perform. An elevated split squat with a forward shin angle and a vertical torso increases the load on the quadriceps and the quadriceps tendon. If this is too irritating, having the shin vertical reduces some of the load. With isotonic loading for tendon pain, time under tension is an important consideration to make sure that the tendon adapts to the loads. So these should be performed slowly over 6 to 8 seconds for each rep. Another option is to perform a reverse Nordic, starting in a kneeling position and then slowly lower the torso down towards the ground. The emphasis on the reverse Nordic is on the eccentric lowering portion as opposed to the concentric contraction bringing the torso back upright. So there's the option to either go back as far as possible, then use the arms to pull or push yourself back up, or slightly limiting the range of motion so that you're able to use the quads to pull yourself back up to that original starting position. Additionally, it's important to add load to these exercises to make them more challenging. Typically, we need loads of around 70% of max to improve the tendon structure, so not only should these exercises be performed slowly over 6 to 8 seconds, we should also load them heavy as tolerated. As for reps and sets, there's a little bit of variability here because it depends on the tolerance to load, but most rehab programs are going to start with 4 sets of 15 reps, and then over 12 weeks, gradually progress to 4 sets of 6 reps as the weight that is being used increases. Additionally, these are typically performed 2 to 3 times per week to allow the tendon to settle down and to rest and recover in between each session. For return to sport, the goal is to reintroduce the movements that were painful initially, whether that was squats, lunges, or jumping. The goal is to start to blend those isotonic exercises and now start to add speed and explosive power into some plyometric exercises. For example, starting with a double leg pogo hop allows us to focus on how fast we're loading the tendons of the knee while still limiting the range of motion. To increase the challenge, we can then progress to a single leg pogo hop, just increasing the load on the tendons. And then once tolerated, we can increase the range of motion by performing a squat jump. So now we're loading the tendons quickly as well as through a larger range of motion. And then we could progress to something like a split squat jump, again with the emphasis of loading and landing in deeper knee flexion, but now we're isolating one side. And don't forget, we can add some variability here depending on the demands of sport. So maybe we do some forward hopping, some side to side hops, or maybe some skater hops, all depending on what the demands of sport are so we can prepare the tendon for those loads. And when it comes to programming, the thing to know is that tendons require a longer recovery time when it comes to plyometric exercises. Typically, we need about 2 to 3 days after the exercise to be able to recover fully. So when we're in this last stage, we want to make sure that we're not overloading the tendon, so we need to plan accordingly when we're reintroducing these plyometric exercises. So hopefully this video on quadriceps tendinopathy was helpful. If you want to stay up to date on all rehab and performance exercises, go ahead and subscribe to the channel so you don't miss any videos. And then feel free to watch this video as well, which I think you'll find helpful.